Let's face it, it's 2024 and healthcare has changed. Have you ever gone to the doctor's office only to be told that you are going to actually see a PA or an NP or an ABCDEFG?
Who are these people? And are they qualified to help me?
Today, we're going to sort out some of that confusion and leave you confident going into your next doctor's appointment. I'm Hope, and I'm a mom and a physician assistant.
And I'm LaVon, and I'm also a physician assistant and a mom. Actually, I'm her mom.
And we are here to answer your healthcare questions right in your living room. When you're going to your regular doctor's office or to a specialty doctor like a heart doctor or called your cardiologist, or even an urgent care or an emergent room, you're gonna see a provider from one of two categories: the physicians or the doctors, and the mid-levels, otherwise known as advanced practice providers, which are your PAs and your NPs, which we'll get into.
So what is the difference in the different kinds of doctors?
Sure. So there's two types of physicians in the US. Medical doctor, which is really kind of what you think of as your traditional doctor, who goes to a specific type of medical school, who's trained in the traditional medical way. And your DOs, which stands for Doctor of Osteopathic Medicine, which are largely taught the same way, except for the DOs are also taught in some manipulation treatments for your joints and spine. But basically, you're gonna be getting the same type of care when you see either of them.
Okay, so when you are actually seeing your doctor, what do you usually call them?
Well, all physicians, you're gonna call them Dr. Blank. For example, my dad is a doctor, and so we call him Dr. Johnston.
Call him that at home, Hope?
No, I do not.
Sometimes he asks me to call him that at home.
So tell us about the second type of providers.
Okay, so the mid-level providers, otherwise known as the advanced practice providers, APPs, you'll hear sometimes, consist mainly of the physician assistants, PAs, or the nurse practitioners, NPs. You'll see that after their names. These two types actually work almost identically in real life. Mm-hmm. You hardly could tell the difference, but the real difference is their training. PAs were considered physician extenders because of a physician shortage in the United States. It started 50, 60 years ago. After the Vietnam War, it's very interesting. They had a lot of experience as in the medics and corpsmen. Yeah. They came back and were hired because we needed extra providers, and they were very experienced. Anyway, PAs have their own programs. And then nurse practitioners have an education that starts in nursing. They actually are all nurses. Mm-hmm. Before they become nurse practitioners, they go for more formal training. In real life, NPs and PAs are very similar. They are taught to do and act and prescribe and treat like physicians are doing for everyone. But they have supervising physicians above them for the most part. And they are by law allowed to do what their supervising physicians or whoever employs them tells them that they are qualified to do. So you will see very much crossover between the physician group and the mid-level group. Hard to tell sometimes.
Mm-hmm. Now, if you're going into an office, what should you call your PA or your nurse practitioner?
That can be tricky, because some do not actually introduce themselves properly like they should.
True.
You should know who you're seeing. If you don't, you can look at their tag. You can ask them, so are you a doctor? And if they're not a doctor, you can ask them, what would you like me to call you? I usually say, call me LaVon. I'm not a physician. What do you usually say?
Me too. I have them call me by my first name, Hope.
If they're a young person or a child, I'll say Mrs. Johnston. But, in general, I prefer them to call me by my first name. I don't want to be disguised as a doctor. I'm not.
Same.
Yeah.
Agreed.
So feel free to ask your own providers. If you don't know what they are, I think it's really wise to ask them. Agreed?
Agreed.
All right.
Now, a question that we get asked a lot is, what type of provider should I see and why? Now, generally, the practice is going to answer this question for you ahead of time with who they book you with. Mid-level providers are used in a variety of ways across practices that the physicians have already approved of, so you can generally trust that. But for most problems, mid-level providers and physicians are trained and are going to give you the same level of care about a problem.
Absolutely. There are some complex and more complicated type of cases in patients that sometimes require them to have the expertise of the physician. For example, surgeries or procedures. I worked in gastroenterology, butts and guts. And in that case, the mid-levels, the nurse practitioners, the physician assistants, saw patients similarly to physicians in the clinic and did hospital rounds on patients. But when it came time to do procedures like the colonoscopies, don't forget to get yours at 45, or the upper endoscopies or other procedures, that was done only by physicians. So we as the mid-levels were extending the time that patients could have with just normal visits and hospital rounds while they did that. Helped a lot with that practice, actually. Yeah.
That's awesome. Now, something I also tell my patients who ask me is that depending on your actual problem, it's often less about the degree of who you're seeing and more about who you mesh with, who you feel is answering your problem, giving you the best care, and making you feel comfortable answering all of your questions. That's probably the provider you should be seeing. Now, what if I just want to see a physician? Or if I don't like my physician and I want to see somebody else, am I allowed to ask the practice to change?
Absolutely. Every patient has the right to ask for a physician if they prefer that over a mid-level, or to ask for a different provider in either direction. If they don't feel comfortable, they haven't been heard, whatever reason, you always have the right to ask for a different provider of any kind. So don't forget that. That's important to know.
Got it.
Yeah.
In conclusion, there are a variety of healthcare providers you might see at your next appointment. You can go ahead and ask your office ahead of time what type of provider you're seeing so that you can have a little bit more confidence going in. I hope this video helped clarify some of those confusing discrepancies between providers.
Absolutely. And we welcome your comments. Please ask us questions. We're here for you. Please send healthcare questions to us so we can answer them in your living room.
Thank you.
That's
Okay, Mom, what is one of the funniest things that's happened to you in healthcare as a PA?
Oh my goodness. I do remember very clearly. I went to wash my hands, as a good PA always would do, as the patient was sitting on the exam table over here, and the faucet fell off into the sink, and a spray of water went not only soaking me from the one whole side of my body, it sprayed up and over me, onto the patient themselves, and they were like, we couldn't react fast enough. We were soaked, and I was soaked the rest of the day. And the humble pie in front of that patient was so embarrassing. But
I bet that patient asked for a physician next time.
I know they did.